Gentlemen, if you are a man over 60 and you want to meaningfully strengthen your erections and reclaim a sense of male vitality, lean in for a moment. For my years as a practicing urologist, I've seen how small, consistent habits deliver some of the biggest wins. And today I'll share a concise, science-informed, 3-minute daily routine that can make a real difference in how you feel and perform. This is not a pitch for a miracle pill or an overnight fix. It's an evidence-based approach you can do anywhere, and when practiced correctly, it helps rebuild the foundation your sexual health depends on. Stay with me. On EverPrime Health Channel, we'll walk through exactly how to optimize your intimate health for years to come. Welcome back. Over decades of patient care, I've learned that a man's confidence is deeply connected to his overall health, and sexual well-being is a major piece of that puzzle. Aging often brings changes in erectile function. That's normal, not a moral failing. And I know how frustrating and even embarrassing those shifts can feel. Let me reassure you, you are far from alone, and there are clear, practical steps you can take to improve function and restore confidence. These improvements aren't hypothetical. They come from strengthening the physiological systems that control blood flow, nerve signaling, and muscular support in the pelvic region. Many factors influence erectile function. High blood pressure, diabetes, heart disease, smoking, certain medications, hormonal changes, chronic stress, and reduced fitness are common contributors. Erectile difficulties are rarely about one single thing. They reflect a complex interplay between cardiovascular health, nerve integrity, and muscular support. Because of that complexity, treatments that support vascular health and pelvic muscle function together often give the best results. Today, I want to introduce you to a foundational and often overlooked component of male pelvic health: the pelvic floor muscles. These muscles are the quiet workhorses that support your bladder and bowel, and play a pivotal role in erections and sexual control. Think of the pelvic floor as a sling or hammock that stretches from your pubic bone to your tailbone. These muscles, especially the bulbocavernosus and ischiocavernosus, help control urinary flow, support the prostate area, and assist with the mechanical aspects of achieving and maintaining erections. Strengthening them won't change anatomical size, but it will improve how effectively your body traps blood, coordinates nerve signals, and maintains rigidity during intercourse. In short, stronger pelvic floor muscles improve performance by optimizing the systems you already have. The exercise program I'm recommending is a straightforward set of Kegel-style contractions tailored for men. While Kegels were popularized in women's health, particularly after childbirth, men benefit greatly from the same principle. These exercises support urinary control, prostate recovery, and, crucially for our conversation, erectile function. Before you begin, it's essential to correctly identify the right muscles. Doing the exercises with the wrong muscles gives no benefit and can be counterproductive. To locate your pelvic floor muscles, picture trying to stop the flow of urine midstream or imagining you're holding back gas. The inward squeeze you feel is the pelvic floor contracting. You should notice a subtle lift inward and upward around the base of the pelvis. The muscles run from the pubic bone at the front to the tailbone at the back. A very common error is tensing the abdomen, thighs, or buttocks. Resist the urge to squeeze those areas. The correct contraction is internal and gentle, not a big, visible strain. Try this while sitting, standing, or lying down until you can reliably feel that inward lift without recruiting other muscle groups. Once you can isolate that action, you're ready to train. Consistency matters more than intensity. The routine I recommend takes just 3 minutes a day and is easy to fit into your life, at your desk, in the car, while watching the news, or before bed. Like any muscle, the pelvic floor grows stronger with regular, correctly performed work. Here's the 3-part protocol I teach: 1 minute of slow holds, 1 minute of quick contractions, and 1 minute of endurance holds. Step 1. Slow holds. 1 minute. Gently contract the pelvic floor muscles and lift inward, holding the contraction for 3 to 5 seconds. Focus on the lifting sensation rather than squeezing other areas. After each hold, relax fully for an equal span of time. Don't rush the release. That full relaxation is just as important as the contraction because it allows proper blood flow and muscle recovery. Repeat that squeeze and release cycle roughly 10 to 12 times. This phase builds endurance and the motor control needed for steady, reliable function. Step 2. Quick flicks, 1 minute. Now we work speed and responsiveness. Perform rapid, short contractions, a quick on-off flick of the pelvic floor, like activating a light switch. Contract and release briskly, ensuring each contraction is distinct and each release is complete. Continue for about 1 minute, aiming for a steady rhythm. These quick contractions help the muscles coordinate with reflexive responses that matter during arousal and sexual activity. Step 3. Endurance holds, 1 minute. Finally, focus on sustained strength. Contract the pelvic floor and hold as long as you comfortably can without holding your breath. Start by aiming for 10 to 15 seconds, then fully relax. Repeat that hold and release 3 to 4 times. Over weeks, you'll lengthen those holds as the muscles gain stamina. This phase builds the capacity to maintain an erection and resist early loss of rigidity. That's the routine. 3 minutes a day, slow holds, quick flicks, endurance holds. It's deceptively simple, and its power is in correct form and steady repetition. Now let's briefly explain why these exercises help erectile strength. During an erection, blood fills the spongy tissues of the penis. To achieve a firm, lasting erection, arterial inflow must be high and venous outflow must be restricted so the blood is retained. The pelvic floor muscles, particularly the bulbocavernosus and ischiocavernosus, assist by compressing the veins that would otherwise allow blood to escape. This process, often referred to as venous occlusion, is essential for sustaining firmness. Stronger pelvic floor muscles improve that venous compression, helping maintain a fuller, firmer erection for longer. Beyond the mechanics of blood trapping, pelvic floor training improves local nerve function and neuromuscular coordination. Think of it as fine-tuning the wiring and the motor in the same system. Better nerve signals plus stronger muscle response equals improved sensation, timing, and control. Patients frequently report not only harder erections, but better timing of climax and a greater sense of control during intercourse. While these exercises do not increase anatomical size, they can create a noticeably more substantial and reliable erection by improving quality and duration. The advantages extend past sexual performance. Men with better pelvic floor tone commonly experience improved urinary control, less dribbling after urination, fewer urgency episodes, and better overall bladder confidence. Strengthening these muscles can also help manage common issues like premature ejaculation by improving ejaculatory control. In short, pelvic floor training is a multi-purpose tool that enhances several areas of pelvic health. As with any exercise, there are common mistakes to avoid. First, do not bear down or push. The action should be an upward lift and squeeze, not a downward strain. Pushing can increase intra-abdominal pressure and work against the muscles you're trying to train. Second, avoid holding your breath. Breathe normally and rhythmically. Breath holding raises abdominal pressure and reduces effectiveness. Third, don't recruit other muscle groups. If your buttocks, thighs, or abdominal muscles are tensing, you're not isolating the pelvic floor and won't gain the intended benefit. Fourth, don't overdo it. More is not always better. Stick to the 3-minute routine daily. Overtraining can cause fatigue, soreness, and even worsening control. One critical medical point I must emphasize. While pelvic floor exercises are powerful and helpful for many men, they are not a universal cure for every issue. If you experience persistent or severe erectile dysfunction, painful erections, significant urinary problems, blood in the urine, new pelvic pain, or other concerning symptoms, seek prompt medical evaluation. Underlying conditions such as cardiovascular disease, uncontrolled diabetes, nerve injury, hormonal imbalances, or prostate pathology can require targeted medical treatments. Self-managing serious medical problems without professional input can be harmful. Early, accurate diagnosis and appropriate treatment are essential for long-term outcomes. Gentlemen, taking care of your body, including the parts we don't always discuss openly, is one of the most practical expressions of strength and self-respect. This 3-minute daily habit is an inexpensive, low-risk investment in your long-term sexual health, urinary control, and overall well-being. Think of it as building a sturdier foundation. When the base is strong, everything else performs better. Physically, mentally, and relationally. For best results, pair this routine with a healthy lifestyle. Maintain cardiovascular fitness, eat a balanced diet, control blood sugar and blood pressure, avoid smoking, manage stress, and prioritize restorative sleep. These habits amplify the benefits of pelvic floor training and support the vascular and neurological systems critical to sexual performance. Before I continue, if this episode has energized you to take action, keep the momentum going. Hit the like button, subscribe to Everprime Health channel, and ring the bell so you don't miss practical, science-based tips specifically tailored for men over 60. Leave your questions or comments below. I read every one, and your experiences often inspire future videos. Tell me what topics you'd like next. More pelvic health tips, workout-friendly routines for older men, medication interactions that matter, or anything else you want covered. Most men notice some initial changes within about 4 to 8 weeks of consistent training, with more meaningful improvements often appearing by around 3 months. Clinical studies in major medical centers report that pelvic floor training can require 6 to 12 weeks of regular practice before benefits become clear. And some men, especially those with long-standing problems or other health conditions, may need longer or additional therapies. What improvement looks like. You might first notice firmer morning erections, better ability to maintain rigidity during intercourse, reduced post-urination dribble, or more control over the timing of ejaculation. These are common early signals that the pelvic floor is responding. Several randomized and observational trials have documented measurable benefits in erectile function and ejaculation control when pelvic floor training is correctly applied. How to track progress. Keep a simple log. Note dates, how many reps you did in each phase, slow holds, quick flicks, endurance holds, and any subjective changes, erection firmness, urinary symptoms, control. Photographs aren't necessary. Your notes and a weekly check-in with how you feel are fine. Tracking helps you stay consistent and gives you objective feedback to discuss with your clinician if needed. When to get professional help. If you've been diligent with the 3-minute routine for 8 to 12 weeks with little or no benefit, or if you have additional red flag symptoms, sudden loss of erectile ability, blood in the urine, severe pelvic pain, or new urinary obstruction, see a healthcare professional. Underlying conditions like cardiovascular disease, uncontrolled diabetes, hormonal issues, nerve injury, or prostate pathology may require medical evaluation and targeted treatment. Pelvic floor physiotherapists can offer biofeedback, hands-on assessment, and tailored progressions that often speed recovery. Medication interactions and safety note. Pelvic floor training is low risk, but erectile dysfunction can sometimes be a marker for more serious vascular disease. If you're considering adding ED medications or supplements, discuss this with your physician, especially if you take nitrates or have heart disease. Self-treating without evaluation could be unsafe. If you have any doubts, seek a professional assessment before beginning new pharmacologic therapies. How to make it stick. Tie the routine to an existing daily habit. After your morning coffee, during a TV commercial break, or before your nightly teeth brushing. 3 minutes is deliberately short, so it's sustainable. Celebrate small wins. 1 more second on a hold, 1 extra repetition, and gradually increase as the muscles get stronger. Partner communication and confidence. If you're in a relationship, let your partner know you're taking proactive steps for your health. Framing this as self-care and shared well-being often reduces anxiety and builds intimacy. Many men report that regaining control and noticing tangible improvements has a bigger emotional benefit than they expected. Over the years in my clinic, I've witnessed men who thought their intimacy was fading for good regain control and confidence through this very routine. One gentleman in his late 60s came to me embarrassed, convinced that age had closed the chapter on his sex life. He had borderline diabetes and was on blood pressure medication. We ruled out serious disease, then I guided him into a daily pelvic floor program. At first, he felt nothing had changed, but by the 3rd month, he reported firmer erections, less leakage after urination, and, in his words, a spark I thought I had lost. His partner even encouraged him to continue because she noticed the difference before he admitted it himself. Another patient, a 71-year-old widower who had remarried, struggled with premature ejaculation and feared he would disappoint his new partner. He committed faithfully to the 3-minute daily training. Within 6 weeks, he noticed more control. By 3 months, he could sustain intimacy without rushing. And by 6 months, he described a confidence he hadn't felt in decades. This wasn't just about muscle strength. It was about restoring trust in his own body. And then there was a man in his early 60s, recovering from prostate surgery. He battled incontinence and weak erections. Alongside medical therapy, pelvic floor exercises became his daily ritual. He used to joke, "Doc, it feels silly doing these in my armchair every evening." But 6 months later, his leakage was minimal. His erections had returned with the help of his muscles, and his overall outlook was brighter. Stories like these reflect what the research shows. Consistency matters, results take time, but with patience, the benefits can be transformative. Stronger pelvic floor muscles mean better blood flow, more reliable erections, improved bladder control, and restored confidence. These exercises aren't about chasing youth or vanity. They're about protecting dignity, intimacy, and quality of life at every age. So here's the conclusion I want you to carry with you. 3 minutes a day, done with focus and care, can open doors you thought were closed. They can give you back control, confidence, and closeness in your relationships. Science confirms it, and real men living their lives prove it every day. Stay committed, stay consistent, and remember, investing in this small daily ritual is really about investing in your freedom, your joy, and your well-being for the years ahead. Summary checklist. Locate the pelvic floor correctly. Stop urine midstream or hold back gas to find the inward lift. Daily routine: 1 minute slow holds, 1 minute quick flicks, 1 minute endurance holds, 3 minutes total. Breathe normally. Don't bear down. Avoid tensing surrounding muscles. Expect changes in 4 to 12 weeks. I hope this continuation gives you the final practical guidance you need to begin and sustain this habit. You're investing just a few minutes a day in something that supports sexual health, urinary control, and overall pelvic function. A high-return habit for men over 60.